I've been sitting for so many hours. Maybe it's just from the long flight. Foamy urine? That's not normal.
Dr. Hee Mun, could this be a deep vein thrombosis related to his kidney disease?
Excellent thinking, Luna. To answer that, we might need help from our Heroic Nephron.
Welcome! I'm the Heroic Nephron. I carefully filter your blood, keeping proteins where they belong. Something is coming after me. This podocyte helps keep your blood clean. I'm your friend. Target identified. Produce anti-PLA2R antibodies. They're attacking my podocyte! The antibodies have called in complement. Now my podocyte is being injured.
My podocyte is injured. The foot processes are disappearing.
No, albumin should never pass through the kidney filter.
Why is my urine so foamy?
We're losing albumin!
Too much albumin is leaking into the urine.
The fluid is leaving the blood vessels.
Without enough albumin, water moves into the tissues and causes edema.
So the swelling is caused by losing albumin?
Yes, but losing albumin isn't the only problem. Patients with membranous nephropathy have a high risk of blood clots.
Why?
Isn't just leaking albumin, it's also leaking antithrombin III, one of the body's natural blood thinners.
Without enough antithrombin III, blood clots form more easily. The clot is getting bigger.
Without enough antithrombin III, dangerous clots can form inside the deep veins.
Ugh.
When the liver senses low blood albumin, it works harder to replace the lost proteins.
It's making lots of L.
Exactly.
Also increases lipolipoprotein production.
Luna, which blood test would strongly support the diagnosis?
Anti-PLA antibody.
Exactly. A positive anti-PLA2R strongly supports primary membranous nephropathy. But before we finish, let's think like a doctor. This 55-year-old man, what important secondary cause should we still consider?
Malignancy.
Exactly. In a 55-year-old patient, always evaluate for malignancy. We should also consider lupus, hepatitis B or C, and medication.
If the anti-P is positive, why do some kidney biopsy?
Many patients don't, but if the diagnosis is uncertain expected, a kidney biopsy helps. Let's take a look.
It looks almost normal.
Exactly. Light microscopy can be subtle in membranous nephropathy.
Those are the anti-PLA immune complexes.
Granular IgG along the glomerular basement membrane confirms membranar IgG along the GBM. Think like a doctor. What is this classic electron microscopy finding?
Spike and dome appearance.
Exactly. The subepithelial immune deposits stimulate new basement membrane formation, creating the classic spike and dome appearance of membranous nephropathy. Luna, which medication targets B cells and reduces anti-PLA2R antibody production?
Rituximab.
Exactly. Rituximab stops the immune attack, while ACE inhibitors or ARBs reduce proteinuria and help protect the kidneys. Mr. Anderson achieved remission. Every patient's journey is different, but early diagnosis and treatment give many patients the best chance for a good outcome.
Wait, only part of this glomerulus is scarred, and the others look completely normal.